I'm going to talk with you a little bit about our substance abuse program. I'm going to go over what our philosophies are around treatment, what our goals for treatment are with our youth that we care for, and talk about the different levels of care that we have for treatment. I want to talk a little bit about the role of family and supports in community-based treatment. Give you perhaps some tips or tools on how you all can help with the youth that you may be working with or seeing, and then a couple resources. So to talk a little bit more globally around community-based treatment for substance abuse, there are a number of different options. So partial hospitalization may be one option. There are a couple adolescent partial hospital programs sort of sprinkled throughout the state. They usually are for co-occurring disorders, so substance abuse combined with a significant mental health issue. I believe the closest one to here is out in Framingham through Wayside. But partial hospital programs are typically like full day programs for a shorter amount of time. I do know that there is one program out in Brookline that is more tailored toward, it's dual diagnosis, but has more of a substance abuse focus for adolescents specifically. So intensive outpatient programming, which is one of the services that we offer. I'm going to talk about that in a minute. Outpatient services that could range from group programming to individual counseling, family counseling, a whole range of services on an outpatient basis. And then self-help. So this could include AA, NA, Learn to Cope for families. So families or clients using the sort of self-help model. So some general components of treatment with adolescents that fit into our philosophy of how we work with our youth is, and some of these I'm going to talk a little bit about in more detail, but conduct a thorough and ongoing assessment. I'm going to talk a little bit about our approach in completing an assessment with a youth. We believe that substance abuse is a family issue. It's not just the youth or the client, but it is a family issue that needs to be addressed. And so therefore, we really develop strong relationships with the youth, the family, and any stakeholders. So it could be providers, DCF, the court systems, whoever is involved in the youth's life. Accountability. So this is important when it comes to treatment. A lot of times in substance abuse treatment, a good example of accountability is drug screens, right? So that's what I always say to the youth, is that that's our fact behind what you're telling us. It helps keep them accountable. Good, consistent communication with, again, the client, but also everyone else involved. Self-education. So you yourself as either the provider, the parent, getting educated and empowering yourself to know what's going on, and that's hopefully partly why you're here today. Know and use the available resources. The substance abuse treatment world for adolescents is really, really small, especially in the Central Mass area. We work extremely closely with the MEAR program, but it's important for everyone to know what the resources are for these youth who are struggling, and I'm guessing that not everyone necessarily does know. And then have a sense of humor. We value humor in our program. We feel like it's definitely a really great way to build a relationship with youth. By the time they've gotten to us, things typically haven't been going so well. Things might be really stressful at home or in their life. And sometimes we just sort of want to lighten things up and be able to get on their level a little bit. So our treatment philosophy is that youth substance abuse is often a maladaptive attempt to cope with life stressors. So the key word there for me is stressors. That is what the youth is presenting as a stressor. You or I may not necessarily think it's a stressor, but if it is for them, that's important in their life. It could be anything from divorce. Parents are divorcing. Maybe they've recently lost someone close to them. Could be stress around school, academics, social, relationships. or even mental health issues. But the substance use has become a maladaptive coping skill for them. Youth substance abuse requires its own treatment program to address the unique developmental needs of the population. So we've heard a lot today about some of the similarities among, what youth and adults may be using for substances. Some of the treatment may look similar, but adolescents are very unique. I think, if we're all working with this population, we can acknowledge that, and the treatment does need to be tailored to them and for them. Family participation is an extremely integral part of our treatment. I'll also be talking about that. And then start where the youth is at. This really flows nicely from what Dan was talking about, and it's really at some of the underpinning of the motivational interviewing. We're starting where they're at, and I'm going to be talking a little bit about more that as well. So our program, we provide a comprehensive continuum of care for youth identified with substance abuse issues. I'm going to sort of summarize this for you so you have a sort of a bigger picture sense of what we do in our treatment program. We also treat youth ages 13 to 18. Very similarly, we tend not to see the 13-year-olds come through as much, and the 18-year-olds, as long as they're enrolled in school or GED program, we can accept them into treatment. We have master level and licensed clinicians facilitating programming. All of the programming is during after-school hours, so the youth is at home in the community, they go to their school or GED program, and they're coming to us during the after-school hours. We use a variety of treatment modalities. It's really a strong blend. We do some cognitive behavioral work, so for those of you not familiar, it's really centered around helping a youth to sort of change some of their thought patterns, and usually their negative thought patterns. Occupational therapy, so this are hands-on tools to help youth better regulate their emotions or their feelings, for that matter. Recreational or experiential therapy. These are typically hands-on activities, games, one might call them. They're really intended to entice youth into participating in them, and then there's a processing piece after. So we can get at a whole number of topics through some hands-on activities. Expressive therapies, so art, music, and motivational interviewing, as Dan also mentioned and talked a bit about. That is really at the foundation of our treatment. We really have the same philosophies around the stages of change, starting where they're at, and readiness for change. So throughout treatment, the goals for any youth coming in, we want to help them increase their insight and awareness. So again, Dan gave some really good examples. We often have clients or youth coming to us who, very similarly, this may not be their idea, right? I don't know many of them who would sign up for substance abuse treatment. It may not be their idea, and so they come to us and they say, well, I'm here because I have to be. I don't want to be here, I'm here because I have to be. We try to get at, okay, so you don't want to be here, but you're sitting here with us, so why is that, right? And usually there's something. Well, maybe it's because their parents are going to call the court soon if they don't come, or they're already court involved and PO isn't going to like it and they'll have to go back in front of the judge. Whatever that is, we'll take it, and we want to run with it because it's something, but we want to help them to see, again, to increase their own insight and awareness to what other people in their life are seeing. So that goes along with increasing their internal motivation for treatment and sobriety. We want them to maintain sobriety while they're in treatment with us. We want to introduce them to and help them engage in pro-social activities. Most are not by the time they get to us. They really don't have anything positive or skill building that they're involved in. We want to connect them to community supports. We want to increase their positive coping skills and identify a relapse prevention plan so they can maintain their goals and their sobriety. I should mention that we also get referrals from just about everywhere. As I mentioned, we work very closely with the WEA program, so more often than not, youth who are living in this area do get referred to us as step-down aftercare. We work very closely with the Worcester Juvenile Court as well as other juvenile courts, but youth will often be referred to us through the court. DCF, other providers, and families will often refer to us as well. So I mentioned a little while ago the assessment. So I just wanted to give a little bit of information on how we approach the assessment, and I think that depending on the capacity that you work with youth, some of this may even be helpful with your own conversations with the youth that you see. We do a full history, sort of the nitty-gritty, but we also look at strengths. We're a really strengths-based program. We want to know what the youth is good at, or do they have interests or talents, or if they don't currently, did they used to? These are things that we want to try to capitalize on while they're in treatment with us. We want to hear from the family or the guardian about the youth's strengths. We want to hear what the family's strengths are. These are all things that we can pull and use throughout treatment to help motivate and propel success. We talk about stressors. I mentioned what some of those are. We want to know from the client or the youth's perspective what they perceive as their stressors. We discuss and evaluate any clinical symptoms. So again, very similarly, we see a majority of our youth having co-occurring disorders. So underlying, for example, depression or anxiety. We want to know what those are as much as we can ahead of time, so we know how to tailor their treatment. We do a complete and thorough substance abuse history. So this may include, but not limited to, what substances they've been using, how often, how much, for how long. A couple things to point out that we also try to focus on is we ask them what their longest period of sobriety has been. Most youth will always have some period of sobriety, whether that's 1 week or 6 months. We want to know what that is, because that tells us they've been able to do it in the past, and if we can help them identify what's been helpful in the past, we can try to replicate that and use that to our advantage, but ultimately their advantage. We also want to assess for any withdrawal symptoms and whether they've been or are mixing substances. Often we see youth for the first time in an initial assessment, and safety is our number one priority, and we may have to refer them directly to the WEA program for detox or stabilization because of the level of their use and the level of risk that they're presenting with. So we need to assess that right immediately. And then we assess motivation. And this is just a little bit on how we do that, not only in the assessment, but throughout our treatment. We typically use a scale, a 0 to 5. So, for example, we might say, Johnny, what's your motivation for treatment? On a scale of 0 to 5. 0 being like no motivation, and 5 being totally and fully motivated, right? We might ask this at that initial assessment, as well as daily while Johnny's with us in treatment. This scale is really helpful for us because, I think we can all imagine what the responses would be if we said, "Are you motivated for treatment?" We'd probably get either a yes, a no, I don't know, or maybe like a shoulder shrug or an eye roll or something, right? So we're not going to get much, and that's not going to take us very far. But using this scale is really helpful because if Johnny is a 5 today, but he comes in tomorrow and he's a 2, we can then have a discussion about, okay, well, what's different? Well, what's different than yesterday? And the flip is also the same as well. So we can use that for motivation for treatment, what's the motivation for sobriety, and we can also use those ratings to ensure that it's consistent with their behavior and also their drug screen results. So if youth is coming in and they're saying that they're totally 100%, they're in it, they're motivated, but their drug screen just came up positive, well, that's a discrepancy. And we can use and talk about that and use that as a conversation piece. And like I mentioned, we use that daily in our group sessions as a way to really monitor, because we also know that motivation is waning. It can go up and down, not only day to day, but hour to hour or minute to minute. So we want to be mindful of that. We also talk about motivating factors. So we differentiate for them internal motivation versus external motivation, because those are very different. If someone's telling you have to do something, or that's how you perceive it, that's a very different motivation than I want to do this for me, or because I feel like this is creating a consequence for myself. I think we could all even think of examples in our own personal lives where that would be the case, right? We want to help them to be able to define that for themselves, and be able to explain their motivation in that way. And then what are their barriers to motivation or to change? Some common barriers that we often see are mental health related, right? So a youth who has debilitating anxiety, and they can't even imagine going 6 hours without smoking marijuana because their anxiety is so bad. Well, that's going to be a really significant barrier. So we need to know that, so we can try to help them with that in our treatment. Other barriers might be, this was talked about earlier, but perception, right? So if they live in a community or a neighborhood where everyone uses marijuana, their friends are using it, maybe family members are using it, it's a norm, right? And they don't understand why they're being asked to stop, that's going to be a barrier as well. So following that initial assessment, we make a clinical recommendation for a level of care. This recommendation really encompasses and is sort of case by case, because it encompasses all the information we've gathered about the youth. We have 2 different levels of care. We have an intensive outpatient, or IOP, which is also known as a structured outpatient addiction program, or SOAP. And then we have an outpatient program, which is just, we call it OP. All services are third-party billable. We do take most all insurances. And I do want to point out that for youth who have mass health, we can set up transportation for them to and from programming through the PT1 process. And we see clients not just from Worcester, but really from everywhere. So this is a differentiation between our levels of care. So our IOP program, it's intensive and it's structured. As you see on there, it runs 5 days a week for 3.5 hours for 20 sessions. We do random drug screens across all of our programming. We have an outside lab company that comes in. They do our screens on site, and we actually have a 12-panel screen, so that means 12 different substances we're testing for, and we get levels and ratios, so it's not just a straight positive negative. We offer a weekly parent support group. This can be an entry level, meaning a youth comes in directly to IOP, or a step up. So maybe we've started them in OP, but they're continuing to struggle. We can step them up to IOP. The youth in this level of care tend to be more higher risk in terms of their substance use. They really need sort of eyes on them, if you will, and sort of that intensive structure. They tend to be using more frequently prior to starting treatment, and overall their use indicates a need for that support. Our outpatient program runs 2 days a week for 10 sessions, and you see the hours right there. We also do the drug screens. This can be entry level or a step down from the IOP program. The youth tend to be a bit lower risk, less frequent use, they may not need as intensive support, or they've been in IOP, they've maintained sobriety and reached their goals. So once a client moves through that continuum, we set up aftercare plan treatment for them. We want to maintain them in treatment with us, and we really tailor treatment to their needs. So this is sort of like a little menu, doesn't sound exhaustive list, but for example, maybe they continue in the outpatient group 1 time a week for a month, right? Maybe we start them in individual or family therapy. We can connect them with psychiatry through the agency. We have an outpatient anger management group, so maybe they roll into that to work on some of those issues. We also have an outpatient girls group So maybe, again, they roll into that to work on those issues. Or maybe we're just, setting up and making referrals for the family or youth in the community. So this is just a quick little summary of the differences that we see among gender. I will say that the substances of use and sort of the data that Dan gave really mirrors what we see in our programming. Not much is that different. What I want to point out to this is that typically the females who are coming into our program are much more higher risk than the males. They tend to have much more complex issues, for lack of a better word. Trauma is often huge for them, really complex mental health issues. And so it makes treating them a little bit different. And they, like I said, they tend to be higher risk, and their use has tend to have escalated to a point that the males have not by the time they sort of end up with us. I just want to talk a little bit about family, because the family component is extremely important for us. So our philosophy is that everyone is affected by substance use, okay? So it's a family issue. As I had stated, it's not just isolated to the youth. Some family members may be actively using substances, which we may know about at time of intake, or we may not. And sometimes we don't ever know, quite frankly, because it's kept a secret. There may be substances in the home. Sober family members, I think this is important, sober family members are often, and I shouldn't even say often, but most of the time are going to be affected by the youth's substance use. Okay, so really the take-home message is everyone is affected. And family functioning is going to be affected. So let's say we're talking about a youth, how might a youth substance use affect family members who are not using substances? Significant feelings. That's what I take from that first one, right? Usually by the time a family is coming to us, things have really not gone well. We often sit with families. There's extreme frustration, anger, wanting to give up, although I don't, I think that the parent and guardian loves their child, but they've gotten to this point where things really are not going well. Fear, maybe fear for the youth's life and for their safety. Or if the parent or guardian has their own history themselves, or family history of substance use, that might be triggered a little bit. So what's important to know if you're dealing with this with the family? We want to validate the family system. We want to acknowledge that it's okay to have those feelings, but it's what you do with it that's important, right? We want to communicate to everyone involved with the youth what's being experienced, observed, and what the concerns are. So we operate as a team, right? We, in our program, are not just treating these youth in a vacuum. We want to be connecting as much as we can with the schools, with providers, to have that bigger picture. What needs to change, and what are the resources? So again, we're going back to resources, educating yourselves, what's out there, helping families to know what's out there, because a lot of families just don't know where to go. And self-care. We really try to impress this upon families. The families need to take care of themselves. It doesn't have to be just through treatment services, but maybe it's, recommending that the family might be treatment, get their own individual therapy, but taking care of themselves is really important. And this last that I bolded and underlined, I think is really important for me. The adolescent cannot change alone. They need the entire family. So many times, because of where the youth and the family has gotten to when they come to us, it really becomes the youth's problem. The youth needs to change. The youth needs to make all these changes. That's not reality. The entire family needs to change, and sometimes that's hard for families to hear, and it's not a judgment, but it's reality. The youth won't be able to maintain sobriety. What I do want to point out is advocating for treatment if it's warranted. Please advocate for treatment if you're working with a youth and it's warranted. And the other piece of this is detention or other punitive measures will not address the real issues. The Worcester Juvenile Court is very receptive to our treatment recommendations, and so I really want that to be known for you guys as well, that locking a kid up or sort of taking those measures aren't going to truly address the substance abuse or mental health issues at hand. So lastly, this is my information. This is also our clinical coordinator, Kristen's information. She runs the IOP program. We also do have a number of other services, which I won't get into. But if you have a youth who might be struggling with social, emotional issues, maybe not just substance abuse, we can help with that. But please reach out to us. We want to be a resource for you. If you have questions, you have concerns, parents can call us for confidential or anonymous sort of mini consultations, I guess. I've had that before. We really want to be working with you all.